Hello, everyone. Tom McKenzie here, Assistant Director of Admissions, back with you to share some information about the Case Western MD curriculum in the university program. So, thank you so much for all you're doing to interview MD candidates for us this year. We are so excited to have you on the interview committee. The purpose of this video and recording is just to give you some insights into the curriculum. You do not have to be a curricular expert. You do not have to understand every aspect of the curriculum. We just want to give you the basics, but any questions about the curriculum anytime, you can certainly kick back to me or anybody in the admissions office if candidates ask you. So we'll go ahead and just run through the basics of the curriculum so you have an idea interviewing candidates. And if you have to answer any basic questions, I suppose you could do that as well. I'm going to go ahead and share my screen and we'll get started. So the biggest aspect of the curriculum, especially the first 2 years, is IQ. And that is the main vehicle for medical education the first 2 years of medical school. You will see the curriculum here is divided into blocks, 6 different blocks, and each block is 10 to 14 weeks. And block 1 is 5 weeks. Block 1 is the short block. Block 1, becoming a doctor, is kind of the introductory block. We're going to ramp you up before you really hit the ground running in medical school at Case Western. Block 1 covers a lot of public health type topics, a lot of introductory items to medicine. We'll talk about things like healthcare disparities. We'll talk about things like health system sciences and medical error and social determinants in health, to kind of talk a lot about those big picture items that as you get ready to embark on this journey and in this career in medicine, here are some things that kind of are some big picture items and some challenges in medicine, some things that lie ahead as you embark on this career. So that's really block 1. Block 1 is a pretty low stress block. I think it's safe to share with applicants and students, and I always do. You're not going to have 10 hours of homework a night or pulling all-nighters in block 1 quite yet, right? You're going to be just kind of learning and easing your way into your time as a medical student. So that first block is 5 weeks. Then students, you can see on your screen, dive into what we call the anatomy boot camp. So this will be 2 straight weeks of intense cadaveric dissection. So you'll dissect during that 2 week time frame. You'll do nothing but anatomy for 2 weeks. Then you'll dive right into block 2 immediately following anatomy. And that's when you'll begin 10 to 14 weeks in each block. So you can see there's a list of themes that kind of highlight the key important teaching points for that particular block. All right. So block 3, you can see food to fuel. So nutrition, biochemistry, cholesterol. Block 6, neurology and mind. You can see block 4, homeostasis. That's 14 weeks. That's the longest block. And that's cardiovascular, cell regulation, all the different types of more cardiovascular type care and that kind of a thing. So pharmacology is also a topic in that block as well. So you can see each block, 10 to 14 weeks. There's also the 12-week research thesis. All students are required to complete a research thesis. It's a 12-week block that will occur between your first and second year, between blocks 4 and 5, as you can see on your screen here. And what will happen is you'll do nothing but research during that 12-week block. I would say at least half the students, oftentimes more than half, will opt to do research even beyond the 12-week block, which is great as well. Many students will do research during the afternoon hours. Much of the classroom time your first 2 years is in the morning, but many students will opt to do research beyond the 12-week block as well. So you can see, if you scroll down I'm going to scroll down even further here. This is a typical weekly schedule for a first year. The main vehicle, again, for medical education is IQ. And in each block, students are divided into case inquiry teams where you will evaluate patient cases of scenarios. So students will be given a vignette, like a storyline. It'll include kind of a storyline, basic sciences with a clinical component context to it. And students will go through this vignette, it'll be paragraph by paragraph. They might review some MRI findings of a patient. They might review some CT scans. They may review some lab results, and they'll go through this patient case paragraph by paragraph, and they'll talk about everything they know, and then they'll talk about everything that they don't know. And every IQ team works together. There's someone that's a scribe each week on the IQ team. There's someone that's a team leader, and they go through each of these patient cases. There's 2 patient cases every week throughout the entire duration of each block. You keep the same IQ teams each block as well. They will change every block. Block 1 and block 2, you'll keep the same groups, but out the same group. But outside of that, you'll switch IQ teams every block. The IQ teams are 8 students. So it's a pretty close-knit gathering every week, and you're a pretty nice, happy IQ family. You're seeing the same individuals each time throughout the entire duration of the block, and then you'll switch and have a new group of individuals for block 3, block 4, etc. So 8 students, 1 faculty facilitator. And the facilitator is there to kind of serve as that quiet shepherd. So usually Monday morning, students receive the patient case for the week, and they don't get it Friday night or over the weekend. They're seeing the patient case for the first time. Then what will happen is they'll talk about everything they know, everything they don't know. And then on Wednesday, someone will be assigned to present the patient case. And probably 15, 20 minutes, maybe a little longer patient case presentation. There'll be some Q&A. There might be some back and forth between team members and IQ. The faculty facilitator may have to step in. Hey, this is really good conversation, but we got to steer the ship this way a little bit. All right. And that's really how IQ will work. It's very student run, and students are evaluated on their participation, on their patient case presentation. I believe on like a scale of 1 to 5. So like your faculty will evaluate you, and then each of your IQ team members evaluate you as a medical student as well. I've really never heard of anyone not passing the IQ portion of the curriculum. It's a complete pass-fail curriculum the first 2 years. There is no honors, award, or merit system of any kind. So it's not there's no secret ranking system. So if anyone wants to know, it's pass-fail. Everyone's on a pretty level playing field, equal playing field, more on collaboration as opposed to competition. But IQ, it occurs in each block. It's 8 to 10 a.m. So in your first year of med school, you'll see 8 to 10 a.m. and then it's flip-flopped. It'll be 10 to noon your second year. And you'll have IQ every Monday, Wednesday, and Friday. Then every Tuesday and Thursday, you'll have what we call Foundations of Clinical Medicine seminars. All right. So that might be small groups. It could be in the form of a lecture. A lot of things you maybe aren't formally covered in IQ, you might have in Foundations of Clinical Medicine seminars. Sometimes they'll even bring in patients to speak about a particular experience. You might observe a doctor-patient interview, but it's a lot of topics that aren't generally covered in IQ. I didn't think about that kind of scenario. What do I do with that if I'm a physician seeing patients? So those are kind of some of the scenarios you'll see when in the Foundations of Clinical Medicine seminars. You'll also have anatomy. So you have the boot camp. Boot camp will be first month or so of med school, right? You'll have the 2-week boot camp, and then you'll actually participate in what we call hollow anatomy next. So on almost a weekly basis, for the most part, you'll have anatomy teachings, and you'll get your own set of hollow anatomy next devices. So it's called augmented reality. So that means I see you, you see me, we see everything in the room, and then digital content is actually inserted into the room as if it's actually there. It's a really surreal experience. It's all about efficiency, I would say. You're going to cover a lot more ground in a shorter duration of time with the hollow anatomy next devices. So that's a little bit about hollow anatomy, okay? So if you keep going down on your screen here, you'll see that 12 o'clock on, you look at this weekly schedule, that's about it. You are going to have a lot of what we call self-directed learning time in the afternoon. Students may pursue a pathway. We have 9 different pathways. They might pursue a dual degree. They may pursue early research. Among pre-clerkship electives, they can pursue a range of things. So students have a lot of time to really get involved outside the classroom and build that resume for next steps as well. A lot of time outside the classroom studying, of course, but decent work-life balance, I think, for a med student can be maintained in our curriculum. Yes, you got to have good time management. You got to have really good discipline. You got to have really strong independence. But overall, students, you're only in class about 20, 25 hours a week, which isn't all that much. So that's your first 2 years. Then you'll jump into year 3 for the clinical core rotations. You're going to have 40 weeks of clinical experiences. And this, you will have a grade scale. It's honors. It is commendable with clinical distinction. And then there's commendable, satisfactory, and I think unsatisfactory is not passing. I don't know if I've heard of a student getting unsatisfactory before, but nonetheless, that is a technical grading scale that will be evaluated, that will be used to evaluate a student in their 3rd and 4th year. Students will actually have 3 different options of how they want to structure their training. The most common is the traditional core option, where students will do all their training at university hospitals, the VA, and Metro Health. And then they have the option to do their electives and what we call acting internships at the Cleveland Clinic. Or students can opt for the Cleveland Clinic longitudinal clerkship. This means they choose to do all their training at the Cleveland Clinic, and then they can do their electives and acting internships at the other three hospitals. Those can be done anywhere. And then lastly, the Metro Health clerkship, longitudinal clerkship. This means you do all your training at Metro Health. This is a small clerkship. There's only about 5 or 6 students in this clerkship a year. And then the Cleveland Clinic longitudinal clerkship usually has about between probably 45 to 55, give or take, each year. It just depends on the year. But the traditional core is the largest one. You can see a very diverse patient population. You'll have very different hospital systems. We're fortunate in Cleveland to be partnered with some of not only the best hospitals in some of the best hospitals in really the country, but also, gosh, you can see a really diverse array of patients. We have been one of the nation's largest VAs. We have a public safety net hospital, and then Cleveland Clinic and university hospitals as well. The acting internships, which generally take place in the 4th year, as well as your electives, those are, from my understanding, if you're doing an acting internship, you're not a resident yet, but you're also kind of past that 3rd year stage as well. You're in a little bit of like a supervisory role where you are not doing the work of a resident, but you're overseeing some of the operations and work of a 3rd year medical student on rotations. All right. So 4th year, you do kind of get your life back. There is a dedicated step 2 study time. That's 8 weeks. I'm going to rewind 1 second and mention there is also dedicated step 1 study time right after block 6. That is 6 weeks as well. There's also a 2-week break that earmarks end of 2nd year, beginning of 3rd year. So 2 weeks plus 6 weeks for step, 8 weeks essentially total, but 6 weeks is earmarked for step. So that's at the very end of the 2nd year. And now going back after the 3rd year, beginning of 4th year, you'll see you have dedicated step 2 board study time as well. You'll obviously be taking your electives. You'll be doing your acting internships as well. You have to do 2 acting internships. There's a range of specialties that you can choose from, and one can also be a specialty of your choice. Students will sometimes participate in additional research. That's becoming more and more common. Probably about 12, maybe up to 24 students each year. That's probably on the high end, but they will opt to take a 5th year as well, depending on their specialty. That's not something we encourage, but it is becoming somewhat ever so slightly more popular. That's not something we I would say, plan out with a student before they start med school. It's more of, all right, I'm starting my research. I'm a fully established student here. Here's the specialty I'm thinking about. Students don't really have to decide this until September of their 4th year, because that's when the residency application opens up. But a lot of the 4th year is spent applying to residency, interviewing for residency. So I always joke with medical students, this whole process of applying to medical school, you'll kind of do it all over again in 4 years. So we'll all look forward to that, right? But anyway, yeah, you can see there's also a transition to residency, kind of like end of the year, end of 4th year capstone. We call it residency boot camp, where we talk about things like leadership and communication skills and really some important things as you start residency. You're a doctor now. So this is kind of that last stash boot camp of, we have a huge skills and simulation center where students will actually begin interviewing standardized patients in their first 2 years, and it'll really continue to have formal education and formal training all the way up until the residency boot camp in your 4th year. So that's a little bit of a brief, quick rundown on the curriculum in a nutshell. I'll go ahead and put this information right on the resource site so you can have access to this curricular sheet. But we hope this was helpful for you, and we look forward to having you all interview with us again this year. It's going to be a great year. We can't wait. And again, you can always direct any curricular questions right to me or anyone in the MD admissions office. Thanks so much for your participation, everybody, and we'll see you on Zoom.